Think so. My phone says 4:30.
Okay, great. Hello, good afternoon, everybody. At this time, I'd like to call the May 15th, 2024 Board of Health meeting to order. I'd like to start with the roll call. Jenny?
Here.
Here.
Here,
Here. 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 Here.
thank you very much. Next item on the agenda is the adoption of the agenda. So everybody has had a chance to review the agenda and the attachments, and this time I'd entertain a motion to approve the agenda.
I would like to move to approve subject to a request to amend the agenda to move 24-22 discussion and vote Assistant Director of Vital Records job description to move it up before item 24-20. Discussion and vote on the budget.
With one also small thing, I noticed that budget was misspelled in 24-21. Unless that's been corrected since the last time I got it.
It has not. So we have a motion to approve the agenda with a couple of amendments. Do we have a second to those? All right, motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on our agenda is the approval of the minutes from our April 17th, 2024 regular meeting. Hopefully, everybody's had a chance to review them and open the discussion to the approval of those minutes.
I'll move to approve. Second.
We have a motion and a second. Any further discussion on the minutes? Hearing none, all those in favor of approval, please say aye.
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 Opposed, same sign. Motion carries. Next item on the agenda, board president announcements. I would be remiss if I didn't once again say thank you to Dr. Pershutham. I believe this is your last meeting. So thank you for all you've done, your guidance, your direction, your foresight. So just appreciate that very much. And during public comment, if anybody would like to add any gushing comments about Dr. Pershutham, please feel free to do so. Love to hear it.
Thank you.
So that's it with the next item on the agenda, the health officer's presentation and report.
Thank you. I don't have too much to add beyond what's already in the report. I did, though, wanted to provide an update on Health First Indiana. We still have 2 contracts that we're working to execute. One of them should be completed and signed by the commissioners next week. And then we have one more that we're working towards. The other thing I wanted to share is that we did submit a request for those KPIs to the different partners that have received funding last week. And we expect that by the end of the month, we'll be getting some information about how they're doing. And we do recognize that in the beginning, one of the key things that they need to do is build their programs. So we're excited to learn about those progresses. On June 15th, the state has a requirement that we input some of the data that we've been collecting into their core tracker, which we have a plan to do. So that should be accomplished. And then we're hoping that in July, as part of the unit spotlight, we can provide the board with an update on HFI. So we will have an entire presentation on how things have been handled, what is the progress that our community partners have been making, and then what is the thought moving forward to how we will execute the future funding. Any questions regarding that?
Anticipate or having data available on in the June health officers report, or would that be more in July?
I think there will be some data in June because we do have the Health First Indiana summary as part of the Board of Health packet. However, a formal presentation summarizing the work that may not be as clearly or as detailed outlined in the board packet will be presented in July. I think Vital Records is the spotlight for June.
Sounds good. Look forward to seeing how it's going with the Health First Indiana stuff.
Thank you. A lot of hard work has been done by many people, so I'm excited to see that too. And then the final thing I just wanted to say was thank you. Thank you to the board, the council, and the commissioners for your support during the year. We've done some really good work together and I'm grateful for the opportunity. I also wanted to thank the health department. We've got some amazing people that work every day really hard to keep our county healthy. And we can see how hard they're working through the productivity of the reports that they've been generating. So I just want to say thank you. It's been truly an amazing experience to work with the health department. They are true servers of our community. And then I think the new health officer is going to have a great team to work with. So I'm very excited for the continued growth of public health in our community. So just saying thank you.
Any other comments or questions on the health officer's report?
Just one thing I wanted to ask about, this would be the nursing section. It would be the second to last page of the health officer's report. One of the things that you discussed is on April 26th, I think these are some of the nurses visited Pediatric Associates of Michiana to speak with their staff about lead poisoning, testing and reporting. And I was wondering if you could give a summary of how that interaction went, and also you indicate that you're reaching out to other family medicine, pediatric providers to talk about lead poisoning. So can you give us more details?
So that specific meeting was actually to address an opportunity to improve reporting for lead. And one of the things that we are hoping to continue to do more of is go to community partners, physicians and nurse practitioners, or just clinical providers in general that are either pediatrics or family medicine, and provide them some information regarding the regulation for testing and the appropriate reporting requirements, and share with them also what the health department can offer if there is somebody who has a high or has a significant lead level. And this really falls in with our strategic plan to be more community-based and provide more community education, and actually go to providers or go to county residents and provide services at that level. So what we're hoping to do is to continue this kind of process where we will offer to come in and provide updates to any clinical organization that is interested in learning about lead, or if we identify areas that we could provide more guidance to, then we try and reach out directly to that organization and see if they'd be willing to host us. So we're hoping for more of that in the future.
So this is the first foray into that.
Yes.
Great.
Any other questions or comments from the board? This month's report. Going once. Going twice. All right. Hearing none, call for a motion to approve the health officer's report.
I'll move to approve.
Second.
A motion and a second. Any further discussion or questions or comments? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is our new business section. Item 2419, discussion and vote, date and time of our June 2024 regular Board of Health meeting. It is currently on June 19th, which is a holiday. So a couple of thoughts are either on the June 20th or June 26th. I wonder if we get the board's input on that.
I'd prefer the 26th. Me as well. Me too. Same.
All right,
I'll live with it.
somebody like it to make a motion?
I move to move the board meeting to June 26th.
We have a motion. Do we have a second?
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Our next regular meeting will be June 26th. Next item on the amended agenda is item 2422, discussion and vote, the Assistant Director of Vital Records job description.
We are requesting to revise the job description for the Assistant Director of the Vital Records Unit. The main change comes on page 3 under job requirements and difficulty of work, where we now list a bachelor's degree in healthcare administration or related field, or a minimum of 5 years experience in vital records as a requirement. With this position being able to fill in for the director in their absence in all aspects, and that position requiring a bachelor's degree, we thought we would also make that the same requirement in this job description.
Any questions or comments for Amy? For Dr. Schuler?
Just one comment I had is that, I appreciate that, for a position like this, that even though it's a bachelor's degree is typically required, there's also an opportunity for people, for individuals who've been in the vital records unit for a while, to have their on-the-job experience count, and still give them an avenue to move up in the department in that area. So it's, I just wanted to say, I appreciate that both avenues are available.
Thank you. Any further comment or discussion? Hearing none, I'll entertain a motion.
I will move to approve the revised job description.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
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 Opposed, same sign. Motion carries. Next item on the agenda is item 2420, discussion and vote on the 2025 budget, County Health Department Fund. Amy?
And I'm going to start off just mentioning that at a minimum, we did put a request in for a 5% increase for all staff members. As we go through the line items, I will just be touching on those that either above the 5% request or anything new or increased from our current 2024 budget. Starting off with the top two, the administrator and the director of operations. This was a reorganization that we did this year. However, it's not reflected in the 2024 proposed budget. The auditors keeps it as it was originally proposed, so that change has already been made. It's just being reflected in our 2025 budget. As you just approved in the Assistant Director of Vital Records, which is account number 11154, we are requesting a salary increase to make that position equal to the other assistant directors within the Department of Health. As we go down to account 11172, Environmental Health Specialists, we are removing one unfilled position, which we did request for the 2024 budget to help with the property transfer program, which we are going to be unable to enforce come July 1st. So we will not need that staff member for that program. Another part of the reorganization that has already been approved is account 11183, the Communications and Event Specialist. The account of 11196, offloading the Health Promotion Specialist, as well as the next account of Director of Hope to HFI funding, which has already been done during the 2024 year. Account 11950, part-time, which is being eliminated, not needing any part-time staff members. The Finance Director at 11988 has already been restructured for the 2024 year, just being reflected here. And I do believe I skipped over at the bottom of page 1, Public Health Coordinator, which is account 11195. That also has a larger increase than 5% due to the updated FSLA standards that are going to be coming out effective January 1st, where if an exempt employee is paid under a set amount, we have to increase their salary. So this increases that salary to keep them as an exempt employee.
That's a revision in the federal law, right?
Yes, yes. An account number 14840, which is group health insurance. It has increased from $18,300 per employee to $19,500. So that is a increase that we don't have any control over. That number comes to us from the auditor's office. The only change made in the 20,000 series is 22406, which is immunization supplies. Requesting an increase due to the number of travel vaccines that we have seen requested through our office. Just wanting to make sure we have enough funds for the next year to be able to purchase those vaccines for our community members. In the services section, 31010 is increasing legal services by $5,000. 33938 Vector, eliminating that funding as it will move to HFI funding for 2025. The liability insurance coverage, count number 34030. That number is provided to us by the auditor's office and does include any liability, could be car accident, liability, medical malpractice liability for our nurses, for our department that covers any type of insurance or liability coverage that the department would need. The other two that have a change are going to be 38012 and 38013. Which is our leased vehicles that the Department of Health has. The auditor's office also provided a fleet allocation number, which for us is the $86,730. That would cover all of the new fleet vehicles that we will be receiving, which will increase our pool by 1, as well as fuel for those vehicles. I don't know the exact account number that will be listed under, so that may change. So I'm not sure if an approval will have to be done pending, that specific account number, but that will be coming down from the auditor's office as well, what specific account number to use for the fleet allocation. And those are the changes for the 2025 budget.
So one question, so the fleet allocation, is that number given to you by the auditor's office too?
Yep, that is correct. Yep, each department received a number for fleet allocation. Even if they are not going to be the primary owner of a fleet of vehicles, because they're going to have a pool of vehicles available for any department in the county, where the county, I believe, is looking to purchase at like a van. So if we as a department wanted to use this van, we could put in a request to use this van to, go down to a conference instead of driving in 3 different vehicles. So every department has been requested to put in a fleet allocation, and that number was provided by the auditor's office.
Is our mobile medical unit, is that included in this?
No, we own that outright. We don't have a lease for that.
I guess I'd like to also mention the budget. Finance Committee reviewed the budgets earlier and did make a motion unanimous to recommend approval of this budget as presented. I did think of one question here, Amy. What was the Vector money for? I know it's been moved out of this budget, so it's not really.
That was any Vector item that at the time Brett needed for the Vector program, whether it be traps, pesticide, droppers, little equipment, IT equipment. There's a program he uses for the Vector program. That was the only account that was available for the Vector program. So anything and everything besides personnel fell under that account.
Supplies, equipment and supplies for.
I just have one other minor question. And when you talked about immunization and supplies increasing due to an increased number of travel vaccines, I guess, does it look like more people are traveling, coming in for vaccines?
Right, it's the number of patients, not the increase in cost of the vaccine. It's the number of patients that we see. I get an order like every other week to order more yellow fever, oral typhoid. We just seem to be going through that quite a bit. So I just want to make sure we have enough available and don't have to go through the appropriation phase during the calendar year, because that's a 2-month process going through the county council on top of receiving Board of Health approval to do that.
I was wondering if also if it was like consistent amount of travel vaccines that you typically needed before COVID, and then obviously you would have had a dip. And are we just coming back up to normal, or maybe that's not something that?
No,
I think
this
we
will
necessarily-
probably be one of the larger amounts that we have budgeted for immunization supplies in probably the last decade or so. We just have more vaccines that we need to purchase as a department, not the ones that we are getting through VaxCare. These are pretty much strictly travel vaccines.
And there is a revenue side to that also, right?
Oh, correct, yes. Yeah, it just goes towards the fund balance, not directly back into this account as we receive the funds. It goes towards the fund balance and becomes part of what we can use for the next year.
And I think what we're referring to is the difference between the fees that we charge, that we also revisit every once in a while versus the cost to us, which is what we're talking about here. So they're two separate buckets.
Only one, just quick clarification on the property transfer inspection work. We still can do some, but it's greatly diminished because of changes to the state law. So there is still some requirement to do some property transfer inspections on some properties. Anyway.
Yes.
Any further discussion, comments, questions on the county health budget? Hearing none, happily entertain a motion to move this along.
I move to accept the budget as stated.
Thank you. We have a motion. Do we have a second?
Second.
Any further discussion on the county health budget? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, item 2421, vote, discussion and vote on 2025 budget, local health public services.
And this is also the HFI grant, which I regularly refer to it as is HFI as opposed to local public health services. For the 2025 year, we are expecting at a minimum $6.3 million in funding. So that is what we currently have budgeted and what you have before you. And I believe your copy should also have some yellow highlighted rows. Those are the new items to HFI. So I will be going through those items. And if you have questions on any of the other ones, I'll be glad to answer those questions. But under salaries and wages, already approved in the 2024 budget, but wasn't submitted in time for this as their Director of Community Partnerships and Development. So that just moves that position here for this budget cycle. And then bringing in the Vector program, which is 2.5 employees. That program is currently funded through the Local Health Trust Fund and the Local Health Maintenance Fund. However, will not have enough money to continue in 2025. So we are offloading the Vector program to HFI in 2025. Also, the School Health Liaison, which is currently grant funded, we are moving to HFI as that is one of the core services as determined by the State Department of Health. And then in section 2 are the benefits, the FICA, PERF, health insurance for all of those positions and the new positions I just mentioned. No changes under section 3. So if we move to section 4, office supplies, this is where I move funds for the Vector program. Operating supplies, then will be fuel, pesticide, traps, vehicle repairs for the Vector program, as well as supplies for our public health emergency preparedness program. We do currently have a $25,000 grant for our FEP program. However, for this next grant cycle, we are going to use that for salary of the local public health coordinator. Therefore, we are needing funds for the supplies for that equipment and PPE. So we're putting that in our HFI budget. In section 7, we are adding items needed for our student health, our school liaison to be able to offer to schools. Right now, the development is being made for a Red Cap program where any school in St. Joe County can go to that Red Cap survey and request an item, piece of equipment. They don't have an AED. They have kids that need insulin, need supplies for insulin. They'll send requests to our school health liaison who will review that request and then make recommendations for items to purchase and supply those schools with. So that's what those funds would be utilized for. Under 8 professional services, we are going to be expanding our radon program to include more test kits and more radon remediation, as well as sending some staff members to conferences. Wanting to add some funds for water sampling for our environmental health program. Training on GPR equipment. We've had a ground penetrating radar for a few years now, purchased with COVID money. However, we have not been able to secure anyone to come to the department to offer training on that equipment. So that is something we would like to see done for our environmental health unit. We would like to begin PFAS reduction testing. That would also include treatment and supplies. We also would like to have funds earmarked specifically for injury prevention for the elderly, as well as conferences to the State Department of Health for our Director of Community Partnerships and Development, who is the lead for the HFI funding, as well as the lead for the HFSJC awardees that we awarded contracts to in 2024 and will do so again in 2025. Our TB program asked for some funds for education, printing, and supplies. Clinical staff requested basic life support certification. We also are interested in replacing the program that Vital Records currently uses with a different program. We don't know what program that would be, so we would just be in the early stages of looking to see what options are out there to replace that program. Under section 10, with the new food code coming out, we will need to be printing new food code as well as updated inspection reports. Under item 14, also with the new food code, we would like to host around 6 different trainings around St. Joe County to train those, just the public food service owners on the new food code and answer any questions they have. And then lastly, under 21A, with having a communication and event specialist, there is some requested equipment to be able to document the events that we have and promotions for the core services that we have, in our department.
And then I'd also just like to add, under section 8 for professional services, we are continuing to have Health First Indiana grant funding opportunities for our community partners. Since we are receiving double the amount of funding to the health department, we plan to double the amount of grant opportunities to about 1.9 million. And we have also added 2 additional core service areas that people can apply to: access and linkage to clinical care and trauma and injury prevention as well. So just giving an opportunity for us to continue to support programs within our community. Anything else?
I think I've already asked you this question and you answered it, but I don't remember the answer. The $500,000 for Vector, what is that?
That's just an increase. In the county health budget, originally we had 50,000 budgeted. Brett is very frugal and very handy, so he was able to, make a lot happen with a little. With expanding the Vector program to its own program this year, there is going to be an expansion of services and items needed. So that could be, anything for, more trapping, more larviciding, and it could be a wide variety of things, but trying to get a full-scale vector program running year-round.
Other questions? Comments? Again, I'll mention that this was before the finance committee and they did recommend that the board approve the budget as presented. Amy, can you remind us what the change from last year to this year and the total funding coming from HFI?
It was around $3.2 million for last year, so it's almost double.
So, I think this is kind of a broad question that I'm asking. I know we've talked about it before, but maybe to share, we know that we're getting this amount of money, 6 million next year, but after that, it's very up in the air. So what did you do when thinking about and putting together this budget? How did you account for that kind of uncertainty regarding the amount of HFI funding that we're going to get into the future?
A lot of big community partnerships. Unfortunately, those would be the first that we would have to eliminate the $1.947 million worth of funding. And then we would have to see what we are able to absorb within our current budget or seek out other grant funding for the services, like maternal infant health. We, have a lot towards that in this program. And there are a lot of external grants that we can search for and apply for to be able to keep those programs going.
I was just gonna say, we don't know what year 3 is going to look like. We do anticipate that we're gonna continue to receive funding, but what that amount looks like is unclear. And depending on how much of a contraction would impact how much we can offer in terms of community partnerships and what programs even within the department we'd be able to continue to run. And of course, all of those decisions are very specific to the amount of funding that we have available and trying to use whatever we have to have the greatest impact, both in terms of what the health department can offer and also what the community partners can offer. Another strategies that the health department is using, as Amy was alluding to, is to continue to look for grant opportunities internally so that we can, if we have a really strong program here with HFI, but if there are other grant opportunities that allow us to support the programming that we have, then that will allow us to continue it beyond this year. So just being very intentional about grant opportunities that we have, and trying to see how best we can extend the impact with the funding that we have now and what we may have in the future, but we don't know what that exact amount is.
And I also think that in talking with you before, you've been very conscious about one of the reasons you're not expanding the number of staff that much is because we can kind of, that's not one of the first things.
I think one of the things that we started off doing is making sure that the health department had the infrastructure to do more programs in an efficient manner. So I believe that we've been able to achieve that, even when we look at what we've done clinically with our nursing staff, adding a public health nurse so that we can do all the disease investigations, which will hopefully happen in July, getting us to a position where we can be more efficient and do more programs without having to increase the cost of having more staff. I think that's why in this budget, you don't see any additional staff being added, because I think we have the infrastructure to continue to develop without adding more personnel.
Can I ask a quick question about oversight? For example, just thinking out loud, on other supplies, like if schools need some sort of item, who ultimately makes the decision about what they do or don't get, or the money spent, or being good stewards with the money?
I think that's going to be the health department, and it isn't just one person. So if there is a request that's coming in from the school health liaison has a system by which she's trying to categorize how expensive is the cost and what is the impact and what is the opportunity. And then that will be reviewed by a subset of individuals within the health department and then execute that funding. And the things that we're offering are we're happy to share to make sure that it is within the scope, but there are like simple things like AED, EpiPens and insulin, but we want to have a quick process by which we're able to provide them with what they're asking in real time. So ultimately, it would be the health department that is going to be making that that decision and taking the responsibility to explain why we made those choices.
Thank you.
Would the health officer review those decisions at some point, just to make
Yes.
sure? Okay.
In collaboration with the school health liaison, and if there's somebody else within the department that would be involved, they would participate. It's a very similar concept to how we approached HFI. When we got a number of grant requests, we had them reviewed by a panel of health department. And then we provided a recommendation. So here it's similar, but because they're smaller items, we want to be able to say yes or no relatively quickly.
Do you have a specific people that are on that panel then already in your brain, like figured out who's gonna do that or?
No, this is a evolving process. We have our school health liaison currently meeting with the different nurses in the different schools to see what their need is. And now we've built a system, as Amy described, through RedCap, where people can put in a formal request and then we're able to see what that need is. Right now, those decisions are being made very locally within the health department, between the school health liaison, anybody else who's involved, and then the health officer. But as things evolve, I suspect the processes can change too.
Any other questions on this fund? Amy, would you mind just doing a quick overview of where these budgets go once they're approved and?
They are, once we receive approval from the Board of Health, I will start entering them into the financial system, and they are due in the financial system by May 31st. After that, the council, commissioners, and auditor will begin scheduling the one-on-one meetings with each department. Those usually happen mid to late July. They will contact Jenny and find out a mutually convenient time for the health officer to meet with that group of individuals to be able to present and give justification for our budget.
Thank you. Any other questions or comments? If not, I'll entertain a motion to approve the budget for the local public health HFI funds.
I'll move to.
We have a motion. Do we have a second?
Second.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, item 2423, discussion and vote, new health officer appointment. Your personnel committee has been hard at work over the last 6 weeks or so. Talking with interested candidates and researching all our options. So the personnel committee has sent to us a recommendation, and I'm pleased to announce that we unanimously agreed on the recommendation for new health officer. The decision was not easy, but we feel like we've got a really good solution. The recommended candidate was introduced to the board in an executive session last week. So the board is aware of the candidate and has had an opportunity to talk with the candidate if they so choose. So hopefully we can move on this issue here tonight. So I'm pleased to introduce the name of our candidate is Dr. Michelle Migliori, our own Dr. Michelle. Dr. Michelle completed her medical training at Manchester College. During her residency, undergrad at Manchester. Medical school was Des Moines, Iowa. That's right. Sorry.
Sorry, I was like, I know they don't have a med school.
I apologize. During her residency, she worked at, interrupt me if I get this wrong anywhere else. She worked at St. Joe Med Center, obtained her medical license in Indiana in 1989. She's been practicing in our community for over 35 years and knows our community very well. Most of her practice has been in the arena of family medicine, which includes managing other healthcare professionals and administering healthcare services. Is that fair? All right. Dr. Migliori has been on the board for approximately 5 years, where I've gotten to know her very well. She has proven herself as proactive, tenacious, and effective a leader with a caring heart that truly loves this community, and you can tell when you talk to her, and she loves the citizens as well. So if Michelle agrees to do something, you can count on it getting done. I wish I was that way. Therefore, based on Dr. Migliori's experience with the Indiana healthcare systems, programs and laws, managing groups and staff and administering programs, building consensus among groups with differing ideas, her knowledge and experience with the community, her understanding of the operations of the health department from her activity on the board, and her understanding and knowledge of strategic initiatives of the Board of Health and the health department. That was factors in our decision. However, the key factor in the decision was maintaining the continuity of the health department programs and policy that we've worked so hard on these last 12 to 15 months with Dr. Parshutham's leadership. So it was important to the committee and I hope it's important to the board as well to continue that progress in that strategic direction. While we would love to have Dr. Migliori as a full-time health officer, that's not an option offered at this time. However, we see an equally fortuitous arrangement given the importance of the continuity of leadership for our department and our staff. So along with our recommendation for a health officer, we are also endorsing and encouraging continued input, consultation, and support from our current health officer, Dr. Parshutham, as a consultant advisor working directly under our new health officer. The Personnel Committee believes Dr. Migliori's leadership, along with Dr. Parshutham's assistant, represents a superb option for the leadership of our community and our health department, and the best option we have today. So again, it was very important for us to continue on the direction that we've set on. And we believe that they will truly continue to work and progress toward our mission and to protect and promote the health of the citizens of St. Joe County. This time, I'd like to thank the Personnel Committee for all your hard work over these months and Dr. Parshutham for helping with the interview process and explaining the role to get the best candidate we could. So with that, I'll open the floor to questions, comments, motions, and I certainly encourage the Personnel Committee to chime in on any thoughts they might have on our recommendation. I guess I'll also add, if the board approves the recommendation of the Personnel Committee, that then goes to County Council for ratification. Is that the right word? And then to the County Commissioners. So we have a couple more steps to go through, but this is a very important one here today. Questions, comments?
Can you guys explain a little bit further how you're gonna divide up that role between the two of you?
I
Or
don't
is that gray still?
Yeah, Dr. Migliori probably can't speak on that right now in this setting.
Okay.
But they have a plan. I think the details of that are still being worked out, but Dr. Migliori will be the health officer and the leader and make sure the day-to-day things are taken care of, and then work, I think, in concert with Dr. Parshutham on maybe the more strategic program development work for the department.
Great.
Any other questions or comments?
I just wanted to say that, Dr. Parshutham in the past year has, brought this health department, in my opinion, has brought this health department to be in a very good spot. And one of the biggest concerns I think we as a personnel committee have had, which John just said as well, and I want to emphasize, is that we want that direction that Dr. Parshutham has been taking the health department in to continue. And Dr. Migliori certainly shared that as well, that desire as well. And so for me, speaking just for myself, I find that this was by far best option that we had for continuing the health department in the direction that we want it to go in. It will be great. I mean, we'll have Dr. Migliori's obviously her input. She's been very involved as a board member with the health department already, and we're just gonna have that in another form, but also to have the continued input of Dr. Prashetham. I know that you two already work very well together, so I don't think anybody's concerned on that front. I feel that this will give the department a lot of continuity, and hopefully that's something that it will be an easy transition. That's what I'm hoping.
At the risk of saying too much, I echo what both John and Ellen had to say. Ditto.
And not just continuity, stability, and so that's important to us.
It was a great choice.
But I think also with HFI, all of the changes just brought by HFI and the vision for the department that Dr. Prashetham brought forward of how to implement that successfully. So far, I mean, I know it's still early, but so far it seems to be working out pretty well. So having that continuity and stability going forward, especially at this time, very good for the department.
Any other comments, questions, suggestions? Hearing none, I'll entertain a motion to approve the recommendation.
I will submit.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed? Any abstentions?
Yes, I abstain.
Thank you. Very good. Next item on the agenda, grant requests, we have none. The item after that, old business, we have none. The item after that is public comment. At our regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during the open session of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. And I forgot to say early on, if you want to speak, please sign up over at the table to stage right. Or is that stage left? Over there. Do we have anybody that would like to speak? Nobody. All right. Very good. Next item on the agenda, time and place of our next regular meeting, we already talked about, will be June 26th, 4:30. Do we know that it'll be here in the chambers, the 4th floor chambers?
Yes.
It'll be here in this room. Next item is adjournment, so I will,
move to adjourn.
okay, great.
Second.
All those in favor say aye.
Aye.
Opposed? Motion carries. We are adjourned. Thank you all very much.
Probably you're about to start the health office. Texted me.
Oh. Did you say what?
No.